Hi.
Hi.
I wanted to thank you for coming today and talking to me a little bit through your story on how we've been able to use antibiotics a different way. Can you tell me more about your troubles with urine infections?
Yes, I've been bothered with urine infections for many years, but it's been much worse the last 2 years.
Mm-hmm.
In 2015, I had 11 antibiotic treatments,
Mm-hmm.
and in 2016 I already had 13.
Mm-hmm. And how old are you?
I'm 94.
Okay. When you're my patient, we've had a good discussion and came up with some strategies. What do you think about those strategies?
Well, they seem to be helping me in that I'm not nearly as ill when I have the infection, and the antibiotic seems to work in a day or two, that I'm feeling really quite a lot better.
Okay. And what are you feeling when you're not doing well?
Well, I just feel a bit nauseated. I just don't feel like eating much, and I feel weak.
Okay.
I would just as soon sit in the chair all day.
All right.
But ordinarily, I don't do that.
And those are symptoms in your body. And what about down there?
Well, I do have some. I haven't had it the last twice now, nearly as bad. The pain in the lower abdomen.
I see.
And quite sharp pain when I urinated.
I see.
But I didn't have that this time, just a little bit.
Just a little.
And I had very little bit pain, very little, hardly noticeable.
Okay. And how often are you having a urine infection since we've been with each other?
It's about every 3 weeks.
Okay. Okay. Little tiny ones though.
Pardon me?
Little small infections.
Yes.
Small problems.
Yes.
Okay. And what strategies? Could you tell me more about the strategies we're using for you?
Excuse me. Well, I have to take the antibiotic, and I'm also using vaginal.
Okay.
Now, at first it was 3 times a week. Now it's twice a week.
Okay.
And I do that Monday and Thursday.
I see. Yeah. And that's a vaginal hormone.
And the vaginal hormone.
But that is a vaginal hormone.
Oh, that's the vaginal hormone.
Yeah.
Sorry. Then I'm inserting. I've forgotten the probiotic. I do that every second day when I don't have the infection, and every day when I do have the infection.
Okay. Okay. And what is something that you mentioned when we talked earlier is about how you're actually submitting the urine and doing your best to follow the instructions. Tell me how that's going for you.
Well, I managed to give you a mid-term, is it
Midstream?
midstream sample.
Okay.
I had a little difficulty first, but now I seem to be able to stop enough
Okay.
to get a midstream.
Oh, that's great. That's great.
I work on it.
Okay. We all should. It's not easy. And what do you have there in your hands there?
This is what's causing my infection.
Yeah. So that's E. coli,
Yes.
and sometimes it's a super bug E. coli. But I'm glad that with the strategies in place, the number may not be coming down in terms of how frequently they're happening, but at least the severity and how much you're suffering is going down, and I think that's something
I
that's
think quite definitely. I know it's going down.
Yeah. And I hear you're pretty active.
Well, fairly active. I have a flower garden and a vegetable garden. And I've been working in those. I'll work several hours in the afternoon. And recently I've been trying to get things put away for the winter.
I see.
So I've been working out 3 or 4 hours after the afternoon.
I see. Wow.
I have to crawl on my knees because I have a bad back, but I managed to get the plants out.
Good. That's amazing. Is there anything you'd like to share with other patients who have had similar challenges like this before?
Well, the treatment that I'm getting now seems to be working.
Okay.
I certainly feel better, much better than I did 2 years ago, say.
Okay.
And I'm not nearly as ill when I have the infections.
Okay. Oh, good. Good. And we'll just go ahead and show what we do for this packet of information. We have the urine collection containers with the name as well as the MRN. We have a requisition here with asking them to box in time when they collected the urine, telling them that it's better to do it near the time of when they can deliver it to the laboratory. Otherwise, leave it in the refrigerator for a short period of time. And then on the urine culture sheet, we frequently add a gram stain add-on as well as midstream because Mrs. Anderson is able to complete a midstream and then we do initial it. So it's allowed us in the laboratory when you are having symptoms to send a urine. And in certain situations, if things continue to go well, we'll ask you to not send a urine until after the pill is not working. But as we start off this process, we want to keep track of things a little bit more. One of the things I forgot to mention, and I'll add now, is actually we should add phosphomycin testing, because that is one of the medications we're using for you to reduce your problem, that sachet of medication. So I really want to thank you for coming in today to show us how we can do better from a urinary tract infection, and have a wonderful day.
Thank you. Thank you very much.
You're very welcome.